So on the last video we talked about releasing the hip and releasing the knee for pain. And it's all about intent, okay? So if you intend to heal, you kind of massage or just apply a nice firm pressure. But the martial art aspect is more of a hit, okay? It's more destructive, so to speak, okay? So right here, when this point is kicked, okay, it really buckles it, okay? It releases the knee, so hard, and it kind of upward at 45 degree. That relaxes this. So there's a healing aspect to it during the rut part because it relaxes it. But the martial art part of it is when you hit this point, it releases it. So his weight will collapse down on that and really injure his leg. Okay, so we have to be careful with that. Next point here is gallbladder 30, which is right about here. And when this one's pushed, okay, it really throws that head forward and that hip out. And it brings forward this target's here and all these targets right here. Now, we go back, this is gallbladder meridian that we're attacking. Those of you who watch the cycle of destruction, when this one's hit, okay, pops forward the stomach and spleen meridian. So the stomach's all through here and here and here, and the spleen, top of the spleen's right here. Well, that pops forward. Those are your targets, okay? And then also, gallbladder 29 comes right in here, okay? And when that's hit, same thing. All those points still come forward. Those are your targets, okay? And when you watch it, okay, when you dig in here, and this one, Jim says this is his, he says that one's painful, okay? And they are. So the aspects of this is when you can kick here, okay, you can take them down. You come in here, you can pull them down. Come in here, you can pull them down, okay? So if I hit here and come up here at the same time, they're going to run into each other, okay? And how does that feel?
Oh, my neck is on fire.
His neck's on fire, okay? And could you fight?
No, my hands are all weak now.
His hands are weak, and what else?
Well, I stuttered back a lot.
Totally offset you, and I could have hit you again easily.
Yeah.
Yeah. How else do you feel? Could you fight?
Weaker. But
You're weaker, could not defend yourself.
Yeah.
Not
I'm still kind of like.
Can you defend yourself right now, or just
I mean,
you're sluggish and brain dead and all that?
Sliding through it.
So, as you can see, you can heal and you can hurt using the same points. And he's starting to come back now. I can tell. You can tell that he's not as
The blood's coming back to my face.
he's not. He's disoriented, and it comes back fast.
Yeah.
Okay.
You know,
But there's a few seconds there, probably a good 15 seconds, that he really wasn't worth the crap, and you guys are watching this, okay? So, and it is kind of traumatic to see, but I hit him with, firm force, okay? But, when you don't care, adrenaline and everything, that's going to drop him all the way to the ground, okay?